Can you see me all right? Yes, all right. So welcome everyone. I'm very happy to welcome you today to this conference, McGill Dialogue. We're very glad to have a group of experts from the community and experts in academia as well. With us are people from various regions, various countries even, and we'll talk today about accessing healthcare and social services for minorities, typically or especially linguistic minorities. We're going to talk about best practices and evidence-based outcomes.
At the beginning, we're going to be switching a little bit from French to English. And then, as you know, we have interpreters and Jackie Vachon, the Associate Director of Dialogue McGill, will work you through these things. So Jackie? Oh, by the way, we have 225 people at least that are registered to the conference. So we're very excited about that. And obviously people will be coming in and out of those talks. So, so welcome everyone, and thank you for registering in such a big number. Okay, so we also have a lot of people that are representing groups. So we have representatives from Health Canada, M3S, le secrétariat, et aussi tous les services de santé, services sociaux.
We also have representatives of various social services, community networks, institutions, and education sector as well as represented. I would like to also thank those who fund us for this project, so Health Canada, as well as the Bureau d'appui from the Bureau of Official Languages. So I'm very glad to introduce Jacqueline Vachon. She is with us at Dialogue, or McGill Dialogues. We have a good relationship, and I hope that you will see how we work together and how the complicity works out. So Jacqueline, so, hello. Very sorry for my accent. I came to Canada later in life, so I have an American accent, but we have interpreters available for you today. Let me see. Let me share my screen. Give me one moment.
Et voilà.
There we go. So we have interpreting services. To access these services, you go at the bottom of the screen and click on the globe.
The bottom of the screen. Oh, there you go. And it's possible to switch back and forth at any time. C'est possible. Changer entre.
It's possible to switch back and forth at any time as you wish.
Also, the conference will be recorded. La conférence sera enregistrée pendant le.
The conference will be recorded. To let you know, the recording will be available after the conference.
Will be available after. Et si vous avez besoin d'une pause pendant le.
If you need a break at any time during the conference, please do take it.
Et aussi, le but de présentation sont de la présentation. Désolée. Et aussi, nous avons beaucoup de personnes présentes aujourd'hui.
We have many guests, many presenters with us today, joining and contributing.
Il y a une boîte de bavardage pour toutes les questions. Et,
feel free to use the chat box for any questions and comments.
Also say that thank you to Santé Canada, to Health Canada for being present at our conference. Jonathan, could you go ahead and start the land acknowledgement video?
Absolutely. It should be on screen. There you go. Back to you, Jacqueline.
Alors, merci, Jonathan.
Thank you, Jonathan. Now, moving to our first guest speaker, I'm very glad to introduce Frederica Nyqvist. She is from Finland. She's an associate professor in social policy in the Able Academy of Finland.
Aging, well-being, and loneliness, with a special interest in the Swedish-speaking minority in Finland. The title of her presentation is Being Small and Outnumbered, a focus on official language minorities. Professor Nyqvist.
Thank you for the nice introduction. I will start to share my screen. Oh, there we go. Now I assume it's okay. You see on the full screen. Yes, I'm very happy to be invited to your conference. This is a highly relevant topic also for the Swedish speakers in Finland. You heard my name is Frederica Nyqvist. I'm an associate professor at social policy at Åbo Academy University in Finland. And this is the only Swedish speaking university in Finland. The title of my presentation is Being Small and Outnumbered, a focus on official language minorities. And I actually borrowed the first part of the title of my presentation. I borrowed the title from a publication that we recently had in the Canadian scientific journal, Linguistic Minorities and Society. And I will talk a little bit more about that publication and that special issue later on. I'm a Swedish-speaking Finn. There are about 5% Swedish speakers in Finland. I was born and raised on the Åland Islands, and the Åland Islands, the unilingual Swedish-speaking part of Finland. They are autonomous, meaning that they have their own flag and own parliament, etc. But you cannot study on a university level on the island. So I had to move away, like many young people do. I moved to the mainland, the Finnish mainland, for my studies at the Swedish University in Finland, and have stayed there ever since and live today in a bilingual region in Finland, in Vasa. And the region where I live in has actually a Swedish speaking majority of 52%. So this area, you can quite easily live a Swedish speaking life in this region, but this is of course not the case in all parts of Finland. So I thought today I was going to tell you a little bit about the background, about the Finnish context. I will also tell you some results from a project, a research project that ended in August this year, the HMIN project. And I would like to end my presentation by telling you some of the results from the special issue for the linguistic minorities and society. I think we have at the end, we will have time for questions and comments. So I'm happy to respond to any comments or questions that you have at the end of my presentation. Okay, so first to start a bit with the background, so you know where I'm from. I don't know how much knowledge you have about Finland. Finland is a small country compared to Canada. We have 5.5 million inhabitants. 5% or 300,000 are Swedish speakers in Finland. And in Finland, you are registered by your mother tongue. You can be Finnish, you can be Swedish, and you can be other. And this has consequences. For example, I, as a registered Swedish speaking, I get all official information from the authorities, from the state authorities, from the tax offices, etc. in Swedish. But you can easily change also the language easily on the internet. You can switch also if you want to be a Finnish speaker instead, or other languages. Finland feel part of the Nordic community. We are very much want to be part of the Nordic community with Sweden, Norway, Iceland, and Denmark. We have also our neighboring country, Russia, on our eastern border, but politically and legally and in other aspects, we are very much more in the same line as the rest of the Nordic countries. I also would like to say a few words about the demographics and the changes that has been going on during the last decades. And here you see some statistics from the 1950 and 2080 when it comes to age and language. And we can see that Finland is an aging country. In the 1950, about 6% of the population was aged 65 and above. In 2018, about 22% is in this age group, and this number or this share is expected to increase in the coming years. And of course, this is the same situation in Canada and in many other countries. But this, of course, when you think about social and healthcare, this has consequences and a lot of thinking how to organize social and healthcare in a sustainable way. We can also see that there have been some changes in the language composition. Still, if I compare to Canada, Finland is a relatively homogeneous country language-wise. We have the two national languages, Finnish and Swedish. And then the biggest language groups after Finnish and Swedish are Russian, Estonian, Arabian, and English. We can see that we also have this Sami language, and Sami belongs to the indigenous languages and is spoken in Norway, Sweden, Finland, and also a smaller part in Russia. And the Sami language in Finland has the status of being an official minority language. There are 3 variants of Sami, and we have also other languages that has an official status, and these are the Romani language, the Finnish Sign language, and the Karelian language that is spoken in eastern parts of Finland and also in parts of Russia. So Finland, during the last decades, have become at least a little bit more multilingual than before, and less homogeneous language-wise. So how come there are Swedish speakers in Finland? This is due to historical reasons. Finland was part of Sweden for almost 700 years. Sweden lost Finland to Russia in 1809, and we gained independence from Russia in 1917. So we are quite a young country, quite a young nation. As I said, due to our long history with Sweden, we have similar type of religion, the legal system, and also the welfare model. And you might have heard about the Nordic welfare model that is the leading model in Finland, Sweden, Norway, Denmark, and Iceland, and meaning that we have a large tax-financed public sector, and it's the public sector who is the main provider of social and healthcare services. We have a relative high socioeconomic equality, even though we can see some changes also during the last decades, and also low poverty rates in an international comparison. It has been argued that the Swedish speakers have a very strong legal support, about the strongest in the world. And the support, or the legal support is defined in the Constitution, where it is saying that the national languages of Finland are Finnish and Swedish. So in a way, we're not a minority language, we're a national language. And this is very much in line with for other countries in Europe that have the same situation. It's Belgium, it's Switzerland, it's Ireland and Luxembourg. The Language Act from 2003 builds then upon the provision in the Constitution, and it regulates the rights and duties of Finnish and Swedish speakers on equal grounds, on equal rights. And then we have provision also of language rights in special legislations like the Social and Healthcare Acts. So the support for the Swedish language is very good. In the Language Act, it's also written that if you live in a bilingual municipality, the municipality are then obliged to provide service, social and healthcare service in both languages. They also say in the act, in the Language Act, that a municipality is bilingual if the minority language group is 8% or exceeds 3,000 people. So it's quite a small number that's required for a municipality to be bilingual. We have quite a lot of municipalities in Finland. We have in total 311, and the municipality is the main provider of social and healthcare services. On this map, you see that this unilingual Swedish-speaking area, the Åland Islands, where I'm from, and then we have 33 bilingual municipalities along the western coastline and along the southern coastline. And 15 of these 33 municipalities has Swedish-speaking minority, and 18 has a Finnish-speaking majority. The next map I'm just showing you because we have a very big reform coming up in 2023. In Finland, we're going to centralize the services for social and healthcare into 8 welfare districts. There's been a long debate and a long process to finalize this reform. But on this map, you can see that in the future, after 2023, there will be 2 bilingual welfare districts in Finland where you are supposed to get service either in Finnish or Swedish. Linguistic rights are reviewed every 4th year when a report of the government on the application of language legislation is submitted to the parliament. The report focuses on the application of language legislation, implementation of linguistic rights, and language relations in the country. And in order for the government to get an idea how it works in the municipalities, a survey is sent out to the bilingual municipalities about satisfaction with services, about attitudes towards the other language group. And this is done every 4th year. And we actually use this data for our study or our contribution in linguistic minorities and society. And our title here was, let's see if I, being small and outnumbered, service and sociocultural exclusion among older linguistic minorities in Finland. And we wanted to focus on older people in specific. I think it's important. We know that the need for healthcare services is increasing with increasing age. We also know that even though we have learned a second language, when you get older, the risk also for cognitive impairments is higher, and it might be difficult to talk a second language, especially if you have any memory disorders. So here we focus specifically on older people in our study. We also compare two different language groups. We compared how it is for a Finnish speaker to live as a minority in a bilingual municipality where Swedish is the majority group. And how is it to live as a Swedish-speaking minority in a bilingual municipality where Finnish is the majority language. So here, actually, the Finnish speakers are also considered as a minority group in our study. We also divided the language groups into 4 different categories. We had unilingual Finnish and Swedish, and bilingual Finnish and Swedish. And we were interested in the satisfaction with social and healthcare services from a linguistic perspective. Are you satisfied with the service that you get from a linguistic perspective? And we analyzed it in our model 2. We controlled for different background variables. And in general, we found that the Swedish speakers, both unilingual and bilingual, were less satisfied with the services in the municipalities from a linguistic perspective. Similar results were found when we analyzed a question if you've been harassed or discriminated against due to your language. Again, it was the Swedish speakers who felt they'd been more harassed than the Finnish speakers. So in this publication, we conclude that despite this very strong legal framework for both Finnish and Swedish in Finland, we still, not maybe so surprisingly, that it's more challenging in Finland to live as a Swedish-speaking minority, as opposed to being a Finnish-speaking minority in a bilingual municipality. And of course, these results are very much also in line with the report presented by the government on linguistic rights in Finland. This, by the way, this article is available on the internet if anyone is interested in reading more about it. Let's see, I cannot, yes. I think it's interesting also to focus on language groups due to the fact that, at least in Finland, we see health differences between the 2 language groups. And usually when you compare the majority groups, it's the majority group who usually report better health and better well-being than minority. And in Finland, it's the other way around. It's actually the Swedish speakers who report better health than Finnish speakers. And the differences are not that quite big, but they are quite systematic when we look at mortality studies, when we look at perceived health status, and also in disability pension. And the differences are usually more prevalent among men than among women. For example, in mortality, we know that Swedish-speaking men live in general 2.5 years longer than Finnish-speaking men, and for women it's about a year. And it has been put forward different explanations or models. How come there are health inequalities between the 2 language groups in Finland? And of course, we know it's quite complicated to understand health differences. There are a lot of different components affecting health, but here, some have argued that the employment situation is a bit better for the Swedish speakers. This could be a contribution. We also know that there are regional differences. The health risk behaviors is a bit different. The genetics could also play a part here, although we don't know how much it influenced health differences. And then finally, an issue that I have been especially interested in is the social resources as an explanation to health differences and social capital. And we know that the Swedish-speaking community in Finland have quite a strong social community or strong social capital as compared to the Finnish people. And it has been also put forward as an explanation to the health differences between the language groups. And before I move on to my next theme, I would also like to say a few words about the situation in Europe. As you probably know, we are part of the European Union. And there are 24 official languages in Europe, and about 10% belong to the linguistic minority. And you see here on the map the countries with 2 or 3 state languages. I already mentioned them. And then we have a lot of other countries with regional or minority languages with official status. Like, for example, in Spain, I actually now made my first work trip since the corona to the Basque country in Spain to learn more about the linguistic minority in the Basque country. And in Basque is, or the language Basque is not a national language, but a minority language with an official status. And multilingualism has been regarded or given rather high consideration within the EU. For example, we have the European Charter for regional or minority languages that was drawn up in 1992 with the intention to preserve linguistic diversity throughout the EU. So also the language situation, multilingualism is also very much on the agenda in the European Union. Okay, I move on to the next topic of my presentation. I would like to tell you a few about some of the results from our project that ended earlier this fall. And in order to explain this project, I have to give you a bit of a background. And I noticed actually, you can see Jennifer Johnston here on the picture, and I noticed she's here at the conference. But a year before, in 2017, I applied for research funding, and I wanted international collaborators. I was looking for collaborators in Canada. I didn't have contacts in Canada, but after emailing some people, they were all appointing me to Professor Louise Bouchard from Ottawa University, and also Jennifer Johnson, Executive Director at the Community Health and Social Services Network, CHSSN. Unfortunately, I wasn't awarded the funding, but I was still able to invite Louise and Jennifer to Finland, and we organized a seminar with the title Language Group Differences in Health and Social Services. On this picture, we made a visit to a non-governmental organization, Folkhälsan, and here you can see the director, Ape Toivari, was telling us about what Folkhälsan do for the Swedish-speaking minority in Finland. And it's a very important organization providing health-promoting activities, services throughout the whole lifespan, from small children up to very old age. And also at this visit, we started to plan for the special issue in linguistic minorities and society that was then later finalized in 2021. I was very much inspired by the meeting with Jennifer and Louise. So I applied for more funding, and finally I was awarded funding for a project called AgeLin, social inclusion among older adults, focus on linguistic minorities in a national and international context. And I would just tell you something about the international part of our project. If you're interested in our publications, please visit our websites that you can see the address down here also on the picture. So it was also a 2-year project. And we started early fall 2019. And a few months after our starting date, we made a visit also to Canada, to Ottawa, Quebec City, and Montreal. And it was me and my doctoral student, Marina Nesman, who's now become a PhD. And I'm very happy also that we were able to do this trip because this was just a few months before the corona outbreak. And it was a good learning experience for us. We wanted to get acquainted with the situation for the French minority living outside Quebec and the English-speaking minority living in Quebec. And we learned a lot. And what I remember from this trip is, once again, that Finland is a very small country compared to Canada. The Swedish speakers in Finland live in quite the same region. And in Canada, you are spread out across a very big country, of course, very challenging when organizing social and healthcare services. And I think actually here, Jennifer is pointing out where you can find the English speakers in Quebec and where CHSSN is supporting them. So the geographical distances is really, and that's something different from Finland. What we have in common, and I'm not an expert, we have also, I mean, you have indigenous people, we have also indigenous people. The Sami in Finland, unfortunately, they do not have the same rights as the Swedish speakers. They are an official minority language group, but still they don't have the same strong legal rights as the Swedish speakers in Finland. What I also noticed that language issues, I mean, you're also, I'm sure, very aware of that, it's a political issue. And I think maybe even so more political in Canada. In Finland, the attitudes towards the language minority is very much dependent also who's in power, who's sitting in the government. When we have the Swedish People's Party in the government, the official attitudes, it's more positive towards minority groups, including Swedish speakers. At last governmental period, the Swedish People's Party had an opposition, they were in opposition. And also during that time, the attitudes towards the Swedish speakers, the Swedish language, and minorities in general were quite harsh. But there were also a lot of similarities, the challenging in getting service in your own language. I mean, that's a common issue seen also in Canada as well as in Finland. As a result of the visit to Canada, we then continued the collaboration and we wrote a publication together with French researcher and researcher from Wales. And we published in May this year a rapid review with the title Social Exclusion Among Official Language Minority Older Adults, a rapid review of the literature in Canada, Finland, and Wales. And this is also freely available on the internet if you're interested in reading more. For this study, we used the conceptual framework of social exclusion, and we were very much inspired by the work of Walsh and his colleagues. And they argued in their study that in order to get a comprehensive view of old age exclusion, we need to look into various domains, like material and financial resources, social relations, civic participations, services, amenities, and mobility. And this box you would find social and healthcare services, neighborhood and community, and sociocultural aspects. And we argue also in our see now. Yeah, we argue also in our review that we need to take into account language in order to understand old age social exclusion. So we searched for scientific articles published between 2001 and 2019. We searched in different languages. We used keywords related to social inclusion, older adults, and linguistic minorities. And at the end, we included 42 articles. We summarized, or we grouped the articles into different themes. We called it socioeconomic influences, social participation, and societal conditions. And I tell a bit more about the societal conditions theme, because in that group you would find also social and healthcare research conducted when it comes to access to social and healthcare. So in this group, we find the largest number of studies, a lot of them from Canada. This seems to have been, in Canada, you have done a lot of research considering service access, but we could find similar results across all countries, across also Finland and Wales, that it's quite common to experience obstacles to service access in one's native language. And these concerns both high and low involvement services. And high involvement is regarded as social and healthcare services, for example, and low is more when you accessing services in the restaurants or in the buses or shops. And not a surprise to you, but we also noticed in the review that the Anglophone and the Francophone older adults, they both encountered barriers limiting their access to health services. In this group, we also had one cross-country study with Francophones and Swedish speakers in Finland. And it was also clear that service access is very much dependent on the concentration and vitality of the linguistic minority. In Finland, we know from earlier research that if the minority is 30% or more, then you can quite easily get access also in Swedish. But if it's less, it might be more difficult. So 30% here is a critical number, at least for us in Finland. So we conclude, or we discuss in this review, that speaking the minority language result in limitations in service access, language barriers, longer waiting times, as well as receiving insufficient health information. And this was also quite apparent during the early months of the COVID pandemic in Finland, where the Finnish speakers got more comprehensive, more detailed interview about the COVID, whereas the Swedish speakers, the information came a little bit later and was not as full, rich in information as compared to the Finnish information. So we also say in our discussion that there is a need for greater understanding of the minorities' contextual realities, as well as improvements in both the linguistic environments and services in the minority language. And there are several authors also call for political and structural reforms in favor of the linguistic minority, kind of positive discrimination for the linguistic minority. Yes, and finally, I hope, yes, I'm in time, and Carmen, you will probably stop me if I'm running out of time. I still, I think, have some time left.
Yes, you do. Going very well.
Thank you. Yes, then some words about the special issue I've already told you about. So it was discussed already in Finland in 2018. And it took quite a while before it was published, but thanks to Professor Liz Bouchard, we were able to finalize the project now in this year. And in this special issue, we have 10 contributions from Finland, Canada, Wales, and various parts in Spain. And the title is quite long of this special issue. It's public policy and citizen-based practices that support social health services for official and co-official language minority communities and international perspectives. What has really been achieved and where are the gaps? And I thought now I'd spend a few minutes to tell you what were the insights, what have we learned from this special issue, and where are still the gaps, where are the shortcomings that we should work also more on in the future. What we learned from this special issue is that there's the increasing globalization and international migration and refugee displacement. This complexify the official and co-official language debate. And this is also very much in Finland. I showed a picture that we are becoming more multilingual, but still the people that have moved to Finland have moved here in the working age, and hopefully they also will get older. And there's now a discussion in my region, how can we provide also high quality services to other linguistic minority groups besides Finnish and Swedish. So it's a migration, globalization complexify a bit also the debate. So it's not just about Finnish and Swedish in Finland, it's also about other language groups. We also know that language barriers in the health and social care sector can lead to misunderstanding and lead even to care errors, especially when you're not able to speak your mother tongue, your first language. So it's really also growing awareness that this is a safety and human right issue. It's about a quality aspect to get good quality care. What is also good is that we see increased legislation in different countries and public policy attention. That's a good positive development. And we also see new approaches. The researchers and people contributing to the special issue, we're talking about active offer. Now this is that's the principle in Canada. When I visited the Basque country last week, they were also talking about this Canadian model and active offer, something that they is promoting. And also in this person and patient-centered care, to receive service in your own language is highly important. And also the professional training, how to train professionals to become bilingual, is also something that was mentioned in the special issue. And as a researcher, I think it's very important to document good practices and also get the evidence, what is working and what is not working. And it's much easier also to spread good practices to other countries and other contexts. We also saw that the important role of civic organizations. I already mentioned the Folkhälsan in Finland. They are really important in promoting health, promoting or giving social healthcare services to linguistic minority. And you have also in your country important civic organizations for your minority language groups. So these were common maybe themes in the contributions. Then we saw also what is still, where are the shortcomings? So where do we need to work more? And as I said, we have good practices. There are out there, but we need more evidence. What is working, what is not working. We need a holistic approach, integrating good practices when it's needed. I already said that legislation and policy, we have policies for the languages, and that's good, but in implementation is lacking. And I have been telling about the Finnish situation. We see that the implementation is also lacking in Finland, despite good legislation. We also saw that there is really a shortage of bilingual social and healthcare workers. This is also relevant for us in Finland, especially in the elderly sector. There's a lack of carers in general in elderly care homes, and there's also a lack of bilingual workers in this sector. since I was invited to this seminar, I just want to say, I mean, this was a seminar we organized a year ago, but I'm just happy that you have this seminar. I just wanted to say that we are other people also in Europe focusing very much on the same topic as you do. In this seminar, we invited experts from different bilingual regions in Finland, in Europe, and as well as Quebec. So this is a pressing issue, not only in Canada, but also in other countries. I think it's very good to network and to learn from each other when it comes to accessing social and healthcare for the linguistic minorities. And this is now my final picture. I want to end with some comments that was made in a report that was published in Swedish earlier this fall by Magma. And Magma is a Finnish think tank and has the role or serves an arena for discussion. And this report was written by Johan Häggman. He's a Swedish-speaking Finn, has been working for almost 20 years in Brussels with promoting multilingualism. He has been working for the European Bureau for Lesser Used Languages, and he's currently working as policy advisor for the Federal Union of the European Nationalities. So this is not a scientific report, but what he did is in this report is that he contacted his big network across Europe and also in Canada to ask, what have you been doing to promote the linguistic minority when it comes to social healthcare, education, media, etc. And in the final chapter, he tried to summarize and bring forward a few points that he says, okay, this is important for the linguistic minority in Finland. And I thought maybe these points also could be relevant also for you in Canada. So I would like to end with them. And what he's saying, and this is also something we know, and we also brought it forward in the special issue, that there are good practices out there, but we cannot just copy paste good practices. We need to learn from each other. That's very important, like at the conference that you are organizing, but we need also to adjust and adapt. He's also saying that in regions where they have a language plan, where they have a strategy, like in Catalonia, like in the Basque Country, in Ireland, Wales, and South Tyrol, this is good for the linguistic minority, the revitalization of the minority language. And in Finland, we have also a national plan from 2000, or language plan from 2002, so it was outdated. Actually, after this report was published, the government wrote a new strategy for the Swedish-speaking language group in Finland, and it was published just early December. So we have now a new strategy with 62 relative hands-on strategies how to improve the linguistic situation for the Swedish speakers in Finland. And in the strategy, one of their suggestion is very much related to the third and final point in Johan's report, the challenges of having an aging population in Finland. And this applies, of course, both to Swedish and Finnish speakers. So far, when people move to Finland, they're usually integrated in Finnish, hardly ever in Swedish. And that's something also in the strategy they want to discuss more and change the situation, that when people move to Finland, it should also be a possibility to be integrated in Swedish or in bilingual, because there's a lack of people, for example, in the workforce for older people. We need more carers in elderly homes that are, for example, bilingual. We have also problem with the demographics of the Swedish speakers, since a lot of young people move, Swedish-speaking Finns move away from Finland. If I remember correctly, you had the same situation also in Quebec, a brain drain of young people moving away because of studies or for work reasons. And here the most popular country is Sweden. So each year, 1,200 Swedish-speaking Finns move from Finland. And that's of course good if you one day move back, but we know also from statistics that only half of the group will move back. And that's one big challenge also for the Swedish-speaking minority group in Finland. So I think I have used my time. I ending here with a picture of the campus at my university. If any of you are interested in coming here, I'm glad to host you also, like I did with Jennifer and Louise. And I say thank you in 4 different languages. Tack is in Swedish, Kiitos in Finnish, and then we have thank you and merci, and you see also my contact information here, my email address. So thank you once again for your attention, and if you have any questions or comments, I'm happy to respond.
Thank you so much, Frederica. This gave us a very nice global view, a bird's eye view of what are some of the challenges when it comes to language minorities. And I see in the chat that there are some questions, so Jackie is going to facilitate the question period. And thank you again, Frederica.
We got a lot of thank yous and good comments for you, Frederica. The first question is, perhaps this is more of a sociological question, but why do so many governments attach power and identity politics to linguistic background? Costs of delivering services in many languages does not seem to be a barrier and might even be cost-saving, leading to better functioning societies. So I think it's a question of governments attaching power and identity politics to linguistic background, and your thoughts on that?
Yeah, I'm not really sure I get now the question right, but I mean, maybe it's related to the costs of offering services in several languages. Maybe, yeah. Yes. This was, I mean, we discussed it also last week in the Basque country, that what do they think? Because we met politicians over there and we were asking, what do you think? I mean, do you think it's as a burden giving services in several languages? And they were really, it was, yeah, they were thinking that this is not a cost for society. It's very good. They were mentioning several times the social cohesion. It's so good for social cohesion, the identity also to live in a multilingual society. So we thought it's worth it. It's also health promoting to have this kind of strategy, to focus on multilingualism also on a political level. I'm not sure if I responded now correctly to the question.
Great. And the second question is, the number of Swedish speakers has gone down over time.
Yes.
How is this affecting health and social service availability? Have the number of services also gone down for this group?
Yeah, this is a very important question. And if you even look further back in the beginning of 100 years ago, I think about 12–15% were Swedish speakers. But as I said, there's a lot of emigration to Sweden, and especially in the 60s and 70s. But still Swedish speakers move away from Finland. That's really one of the great challenges, how to get people to move back and stay also in our country, but because consequently it affects the services that you can give to the Swedish language minority. There is a lack in my region, even if I live in a very bilingual area, there's a lack of bilingual social workers. There's a lack of medical doctors, there's a lack of healthcare staff. So it has consequences also for the services now.
somebody asked, this is somebody local asked, are Swedish and Finnish languages fairly similar, or are they as different as English and French?
Yeah, I forgot to say that, because that was one of my, I thought I was going to say that in the beginning, and that, yeah, it's equivalent to English and French. They're totally different languages. You couldn't understand, if you just know Swedish, you wouldn't understand Finnish. As a Swedish speaker, I understand Danish and Norwegian, not Icelandic, because that's a bit different, but Swedish and Finnish are totally different. And that was also interesting visiting Spain. Now I'm so fulfilled with the Spanish experience, but they said that the Basque language is also very much different from the Spanish. If you compare them to Catalonia and Spanish are quite similar. So there's more easily to learn those languages. So our Finnish and Swedish are totally different.
Great. You had mentioned earlier that if there was an 8% or more of a linguistic minority in the population, then they could receive services in that language.
Yes.
So that means if Russian or Arabic reaches that level of population, does that mean the Finnish government would have to translate official documents? What are the implications for immigration?
No. Yes, yeah, was a little bit unclear. This applies only to Swedish and Finnish, not for other languages, because Finnish and Swedish are the national languages, so they have a special status. It does not apply to other languages. It's in the Social and Healthcare Act that they should, as far as possible, receive service in their own language, but it's not, the municipality is not obliged to provide service, for example, in Russian.
I see that we're about out of time here. A few people had some very good comments about your presentation, and we have somebody who's a Swedish-speaking Finn who was very happy to have this talk. And a few people were talking about the negative ramifications they could see for not allowing multilingualism. So I think that's. Oh, maybe we have time for one more. Why is there no protection for Indigenous Sami?
There is protection. I mean, they have in the 1960s, there was a political awareness that we have to preserve this minority group because it was about to disappear. People could not longer speak Sami, and we saw a great reduction. So it's an awareness now to preserve the language. And as I said, it has a status as an official language minority. So in the Sami region, that's more in North Finland, they also have special rights. But again, they have not as strong rights as the Swedish speakers in Finland, because again, we are one of the national languages.
Great, thank you. Those are all the questions that we have, and the timing is perfect because our next speaker is starting at 10 o'clock.
Wonderful.
Thank you so much.
Thank you. Thank you very much.
And thank you, Jackie, for facilitating the questions. Great questions and comments.